Hello, and welcome to this season of Alter Eagle. We are starting season 1 with the topic of addiction in Butler County. Conversations on the physical side of addiction, trauma, the neuroscience, mental health, and stigma surrounding addiction. Experts, resources, and stories from people who have fought addiction head on. I am your host, Laura Crago. Let's keep the conversation going. Now a word from our sponsor, BetterHelp. For a long time, I suffered with depression and anxiety. I had tried therapy before, but struggled finding a therapist I connected with until I found BetterHelp. That's why I am so excited to share BetterHelp's mission to make therapy more affordable and more accessible, because finding a therapist can be hard, especially when you're limited to the options in your area. BetterHelp is a platform that makes finding a therapist easier because it's online. Remote therapy sessions, and by filling out a few questions, BetterHelp can match you to a professional therapist in as little as a few days. It's easy to sign up and get matched with a therapist. Click the link in description and receive 10% off your first month of BetterHelp. And by clicking that link, you support this channel. Plus, you can easily switch to a new therapist at no additional cost without stressing about insurance, who's in your network, or anything like that. I was struggling for a long time, and BetterHelp was where I found my therapist, Whitney, who I still see weekly for almost 2 years now. So, if you're struggling like I was, consider online therapy with BetterHelp. Click the link in description or go to betterhelp.com/alter eagle. That's betterhelp.com/alter eagle. There's no better time than now to start your mental health journey. Thank you again, BetterHelp, for supporting this channel.
Let me take a sip of water.
Yeah, let's, maybe I need a sip of coffee. Jeez. It was a triple shot morning. Okay.
You see that on your coffee?
Can you see it on my cup? I was like, give me a triple shot oat milk. Put a little extra vanilla in there. Okay, we're good. Joining me today from Butler County Drug and Alcohol are Lisa Gill, Prevention Program Specialist, and Tracey Hendrix, Drug and Alcohol Case Management Supervisor. Welcome.
Morning.
Good morning. Good morning. I feel like we've done this already. We have. Okay. So they provide community outreach, prevention, education, and treatment services. So we're going to talk a little bit more about what you provide. And Tracey, I think you're the one that's going to get us started.
Okay, so our office provides assessments for people who are looking to get into treatment, whether it's withdrawal management, inpatient, outpatient, whatever is needed. What our case managers do is we meet them where they are. There's a lot of questions that are asked, some personal questions, and our case managers just try to sit back and listen and making sure that that our individuals know that we care. So within those questions, then we determine where they need to go. And in Butler County, we do have 2 inpatient places, but we provide services throughout other counties. We have contracts with them that we can help facilitate getting them in the places, and sometimes facilitate with them because they provide the transportation for our people to get there. There's been times that that need is there when it's after hours. So that's where we contract with Center for Community Resources. And in order to do that after 4:30, you call the crisis number. They will get you established with the on-call worker for drug and alcohol and help you get into treatment right there and then. They've gone to the hospital, their homes, their office, so out in the community. And anyone can call and get those services. And if insurance is an issue, they're also able to accept these people and to approve the Butler County Drug and Alcohol to pay for that and to help them through that process.
Fantastic. Can anybody just walk in? Can they just show up to Butler, or do they need to call first, or what's the best?
Well, the best is to call and set up an appointment. But we do. We have those individuals that come in that they're not sure what to do, and then we will have them fill out. We have a little intake form. If we have to, we'll meet with them then and there. If not, if they can wait, if it's more like outpatient that they're looking for, that sort of thing, we'll get them scheduled and get them in. So, yes, we've had a little bit of both, and we deal with it at that time. We've had people detoxing in our office. So we have some space at the county, that rooms that they can sit in, so that they're not in the middle of everybody looking at them when they walk in. So there's a lot of privacy, and it's all about privacy. We don't, if we don't have a release, we don't talk to those individuals, but we try to get them where they need to be when they need to be there.
Okay, that's great. So your position specifically, you're kind of like a bridge, right, to your caseworkers. I feel like you are the.
Yeah.
No, I don't know if I'm using the right word, but
what I do, I'm there for my case managers. They hear a lot of things throughout the day, a lot of stories that some of them are people are in trauma, and they don't know what to do next. And, everyone needs to vent, even the people that walk in our office, but even our case managers need that. And that's where I come in and listen and help them through that, answer questions, whether it's who do we reach out to? Can we pay for this? We've helped with not any inpatient, people can't pay their whole deductible, so we help them with that. And it goes by your income. You may have to pay maybe $3 a day to go to outpatient, to where we pick up the rest if needed, or to help. Some those deductibles are huge, and people, I can't afford $3,000. Who can?
Yeah, who
today?
can really today?
Yes.
Everything is expensive.
So we have those dollars to help that with.
That's wonderful. So Lisa, we want to talk a little bit to you about what you do. But I want to get into your why a little bit before we get into that, prevention side of addiction with you.
Sure.
Yeah.
So, my why, I think when you and I talked before, I shared how when I was in college and getting my degree in social work, there was the opportunity to take courses so I could learn a little bit more about mental health or drug and alcohol issues. And I was like, I don't know that that's really the field I'm going to go into. Well, surprise, when I went out into the real world, those mental health and drug and alcohol are really just mixed and intertwined into every person that you work with. So kind of fast forward to my last job. I worked at a church here in Butler, and we had several different ministries that supported people who had a substance use disorder or who were in prison. And to hear the stories, some of the things that they had been through, and their why behind what got them started experimenting, using, excuse me, and developed into a substance use disorder, and that kind of maybe hit rock bottom, whether it was in jail or an overdose or some of the things that they had to do to obtain their substance, their choice substance. I heard those stories and, could see that they just weren't feeling that they were the person that they were supposed to be. What I think that we're all created we have our certain gifts, we have our certain, gifts to the world and the things that we can contribute to society, and they weren't able to do that. And I saw the feelings that they had, but yet they weren't that different from you and me.
Mm-hmm.
You know, when I went into the prison one time, and a woman talked about her dream of owning a home and having a white picket fence. And I don't know why that surprised me, because I felt like, well, that's the farthest thing from where she is now, I guess. And so I thought, well, like, I can relate to that. You know, we want to have our sense of safety. We want to have a home, a place that we can call that's ours. But I would also hear them talk about the anxieties they have, the worries that they had, and I could totally relate to that. So we're not that different as human beings. Just some of us choose different paths or maybe different coping mechanisms. Theirs happened to be substance use. And so that got them down this road that maybe they ended up in jail or overdose or, you know, something like that. And I remember, you know, sitting across from people and them kind of being like, I don't know what's next. I don't know what to do. I don't know who I am. And I love before and after stories, you know, like I'm a sucker for makeovers, for house makeovers,
Oh my God.
makeup makeovers. You know what I mean?
The house makeovers. When they
Right.
move that bus, right?
Right.
Okay,
Yeah.
sorry. Yeah,
Yes,
you're
exactly.
like, you love it. And
Right.
you're like, just
Yeah.
so happy for people that need that.
Right.
And they get, yeah.
And so in that role for 8 years, that was some time. So to see people where they were and where they ended up, like, talk about a makeover story, you know, talk about that hitting rock bottom and pulling yourself up out of that pit. There was one person in particular I remember visiting in the jail, and just kind of looking lost and feeling lost. And now that person is out in the community providing services for people who are still in a substance use disorder. And I mean, doing it with amazing energy and amazing passion. And so I just think, like, that's what that person was born to do. Had they not been on that path of a substance use disorder, maybe that person would have been doing that in a different method or a different delivery, you know. But wow, the impact that they're having in the community now is amazing. And so I think about, you know, how can we, and that's why I love the role that I have in prevention. I get to hopefully help. You know, it's hard with prevention. There's a lot of scientific research behind prevention and what works and what doesn't work, but it's always hard to know what impact am I really having, because you don't know what the outcome would be otherwise.
Yeah.
But to know that we can help somebody just feel like they are the person they're supposed to be, to have confidence, to have resiliency, to be able to have coping mechanisms, to know how to stand up to things and just know more of who they are, so that hopefully they don't take that path, so that we can save a life, so that we can, you know, help our community and save our community cost of having to deal with a substance use disorder and treatment and, you know, probation, all of those things that add into that. I just, that's why I love this role. That's why I love what I get to do. And we have a team, you know, we contract with several providers that get to do that, and they all have amazing heart and passion to be able to do it.
I love everything that you said, because that's a huge topic this season, is stigma behind addiction and how we treat people, right? Someone even said the other day, like, if you see someone on the street, you know, they're struggling, like, just look at them, you know, maybe say hello to them. You know, you walk past people and you just say hi to someone randomly, like, hey, it could totally change their whole day, because they're noticed, right? They're seen. And what you said too is how we're not that much different, right? We aren't. We have the same dreams, same goals, anxieties, same Mondays.
Yeah, exactly.
Today's a Monday and I'm having a Monday. I'm having the Mondayest Monday. But I love that you said that, because not enough people look at it that way. It's cool that she told you that. She trusted you. That's a huge part of this too. So I love that. Tracey, I want to hear a little bit about your why. We didn't get into that yet.
So I started my career as in mental health with children, actually, and then moved on to case management, all mental health, for probably my first 20 years. And not saying that drug and alcohol did not affect a lot of those individuals. So there was a lot of co-occurring. And it's because, you know, the drugs out there, they're quick. mental health drugs, it takes time. So when they need that, I need to get away feeling, that's where this addiction comes and it takes over. So then after that, I got into just drug and alcohol, and I also worked with people who have HIV.
Wow.
And some experience with that and case management. My biggest part of my world was case management, serving those in the community to find the resources that they need, whether it's housing or mental health, drug and alcohol, physical health, whatever was needed. That's was my role, and came into the supervisory position to help expand that and to help others in the community. I've always wanted to help other people.
Yeah.
Started out with, it was all kids, and then the adults, I just became fascinated with working with them, what their niches were, what was going on in their life.
Yeah.
So that's where I'm at. And now, in the position that I am here now at the county, I'm able to put forth more efforts into the community, helping. I'm helping with the advocacy group with getting the recovery center up and running. I'm just being there for them to help them, help guide, because it's their decisions. So that's exciting, and just being a part of a lot of the community events now. So getting the word out, being on the coalition, that sort of thing. And now helping, I'm more on the first hands, not after the fact that they've already used, and I'm trying to find them resources now, helping our case managers with that initial walk-in. Is it going to sink in the first time, or is it going to take a little time? That's the patience we have to have, and meeting everyone where they're at.
Meeting everyone where they're at. Yes, that I hear that all the time, and that's not easy for anyone out in the community who doesn't understand, really, and which is why we're having these conversations. We're trying to really change everyone's perspective on how we are treating people, because that can have a huge impact on someone's life, right? You're meeting them where they're at. They have to build trust, right? Alyssa Verrill had said that to me when we sat down and talked, and she said, when someone first comes in, you have to build trust with them, right? They don't come in and immediately the first thing you say is, all right, let's talk about your trauma. Let's talk about why you're here and what's going on. Most of the time people don't even know. The rehab center, Rachel Schuster brought that up a little bit. She did talk about that. That is going to, first of all, that building, I love that building. I love that something's being done with that building.
Yeah.
But
it's huge, too. You don't realize how big it is until you get in there.
Yeah. And so that's going to be a wonderful space, because that's part of there's nowhere for anyone to go, right? Everywhere you go, like if you go to a bowling alley, there's alcohol, right? If you go to a bar, if you go to a restaurant, there's
even community events lately.
Yes.
There's tents where they're selling alcohol.
Mm-hmm.
And if somebody's had a substance use disorder, that could be a trigger, that could be a space where they just feel like this, I can't do this. So then they feel like ostracized almost from community.
They feel alone.
Yeah.
And human connection is another huge part of this conversation. We all need it. And that's what really happens is people isolate themselves, and then that's when they're doing those self-destructive behaviors. They know what they're doing. They don't want to be like this. Nobody wants to be homeless. Nobody wants to overdose. Nobody wants Narcan. And that's part of the conversation too. I actually carry Narcan now. I've got Narcan over there. I have it in my bag, and I have some at home. And if I could save someone's life with that, and maybe that's the time that they come to you or they go to a rehab, and that's when it starts to really sink in, right? That's when things start to actually make sense. Because I hear these stories, But they start to realize every single time, they're like, I don't want to be doing this. This is not what I want to be doing. They start to feel guilty when they relapse. They start to feel all these things that they're like, I don't want to feel like this. So it's wonderful that you are doing that, meeting them where they're at. So your involvement in the
Butler Recovery
Center, what can you say about that? I mean, right now, I don't know if we're like waiting for like a big reveal.
No,
if there's anything, yeah.
They're still putting some things together, but I want to make sure there's people there that know where they're coming from, that they can help them, and they'll be able to help them find resources. It's going to be a place that, hopefully there's some games or puzzles or food or exercise. They want to do. There's so many different buckets they've been talking about. There's 4 different buckets, and they want to, but to start it out, we want to get people in, look at it, and then we'll go from there. They'll see what people need. They think everyone thinks we know whatever, not everybody, but what people need. But until they walk through those doors, it might be something different that they have to develop.
Like, what are their interests? You might have, that's an interesting thing. Like, immediately my brain went to like cooking classes, like something like that could be really cool. If you have obviously the ability to do that. Who knows? You never know. People are going to come in there and find out what their interests are, right?
Right.
There is actually a gentleman, there's an art studio in Zillionople, and he does like pottery classes and stuff. And he's doing one for Valentine's Day, like a ghost one, with couples. I was like, that's awesome. I was like, I want to go to that. That's pretty fun. Hopefully we can get more people in the community to provide those sort of resources, right? Out of the goodness of their heart, because everything costs money these days. And if we could be like, honestly, we don't have the money to bring some fancy chef in, but what if you came and you talk to them about your story? I mean, I'm already thinking of connections right now that I have. We're just putting this out there right now. I'm just totally inserting myself into what's going on there. And you're like, we haven't opened our doors yet, so pump the brakes. But that's wonderful. I think that's going to be a really amazing space, and it's going to make people feel like they're a part of our community, and that's huge too, and they're healing.
And it's the people that are in recovery that are going to run it. It's their baby, so to speak. So it's exciting. It's exciting to watch them talk about things and get to and really collaborate with each other. So
awesome! I can't wait for it to open. That's very exciting. So resources. You are a wealth of resources, right? So when people come to you,
so resources for, like I said, 8:30 to 4:30 we're open. You can call us. You can ask what resources are out there for me to get into treatment, or, we have the AANA community also with their meetings and those resources there. We also have other MAT groups that are out there, and because not everybody's for AA or NA, so there's smart recovery. There's different things. So there are resources out there that we can help get them hooked up with. And then again, after hours, we have the after hours that you want to go in to inpatient or withdrawal management right here and then. We have those resources with the Center for Community Resources. Call in that 1-800 crisis number to get connected.
You said MAT, and I've talked to a lot of people about MAT, medical assisted treatment, right?
Yes.
So some people need that, and that's another conversation we need to have.
And you have that both into the recovery community and outside.
Mm-hmm.
But you have to look at it. Doesn't have to be forever, but it has to be with counseling. You can't just do it I'm going to be on this and that's it. You have to really delve into where those triggers are, and how do I get away from those triggers, or what can I do when I start having those triggers, and how to educate educate themselves about their own being, and really learning about yourself and what happens when you go here or there. You know, even as simple a smoker. You know, if you're looking at that, okay, you're quitting, but then you need to get rid of all your ashtrays and you need to get rid of all your lighters, because those could be a trigger just for as simple as something as picking up a cigarette. Same thing with drugs and alcohol. You need to get rid of those things, or even maybe the people that you hang out with.
I really think that what both of you are doing, and hopefully you know this and people understand what you're doing, is so important, especially in Butler. I just remember before I moved back, I would always hear these stories of, someone actually said it once like it was a good thing. They were like, oh, the heroin capital of the world. And I'm like, what?
Yeah.
Like, who? What are you talking about? Like, what do you mean? Because I didn't, when you don't experience something, it's like, I know a lot of people that are like, oh, I just don't pay attention. I'm like, well, that's part of the problem. That's part of the problem. Like, we're not paying attention. And why are we not paying attention? Because none of us are immune to this. I'm not immune to it. You're not, none of us are immune to this. I'm meeting people and talking to people. I mean, people that I went to high school with, and I'm hearing these stories. And I went to high school with people who have died from overdoses. And you hear it and you're just like, what? Like, I thought they were just smoking weed, or, I didn't realize that they were doing heroin and now fentanyl. And like, you could show me, you'd have to show me fentanyl. I'd be like, I don't even know how I don't know how it's, do you know what I'm saying? I have no idea. I'm completely ignorant to how it's administered, it's taken, what do you both do to take care of yourselves? Because you said you'll have a lot of people, a lot of your case managers will come to you. I can only imagine the stories that they're hearing. So they're coming to you and you are navigating them through that and how to manage, right? And a lot of people say you just got to leave it. You can't take it home with you. And that's easier said than done. So what do you do to take care of yourself?
Well, I try to, before I go home, is, okay, what went on today? What needs to be, what can I fix? What can I not fix? I'm a fixer.
Me too.
But I've learned that you can't, after doing this for how many years, you cannot internalize it. I used to internalize everything or everyone's story, and really, and that was not good for me. You know, this is their story. I'm here to help them. What they do with that help, it's up to them. And that's where I have to have my mindset. You can't fix everybody. Everybody's different. Everybody's in different places. What might work for one doesn't work for the other. And you might need to find something else for that person. So that's why I try to, like, for my case managers, I try to, hey, you guys doing okay today? I want them to know that I'm there for them. Open door policy.
I love that.
And I'm hoping they know that. I mean, I've only been there since June. I've known them for several years because we've collaborated, because with my other jobs and everything. So as for myself, I just know that if it was not a good day, I'll sit in my driveway and just try to decompose and go through my day, and because I don't want to walk into my house like firing things. I know I have a 16-year-old son, so I know there's going to be, hey mom, or whatever, or my husband when I walk in. So I need to try to be there for them. Does that always work? No. I'm not saying I'm perfect and I don't take it home, because no one is. And that's a lot. So, and sometimes you just got to do things for you. If it's not doing anything when you get home, then that's what you have to do. If you're a walker, go for a walk, get some fresh air. I keep telling my kids, take deep breaths, and they laugh at me, but it works.
Oh yeah.
The more you focus
Vagus
on that,
nerve.
so
Yep.
it works.
Let's fire it up, right?
Yeah.
So, hey, you got to get your hair done sometimes, or your nails done, or
Mm-hmm.
you have to have some you time. In this field, you always have to have some you time, or you'll get burned out way too quick.
Yeah, I agree. Lisa?
So I can't pretend that I hear the same stories that her case managers do. I mean, I really appreciate the case managers, the people who are working one-on-one with people who are in a substance use disorder. And when I was in those roles before, it was a lot harder. So I'll say that I am kind of removed from that, but I so much appreciation for what everybody does who are on the front lines. I don't have that same, I'm not in that same position. But I have talked to parents who are upset. I have gone into classrooms to present and say, we're going to do a program called Too Good for Drugs. And I have people raise their hand, and people, fourth graders is the class that I'm usually in, say, my brother died of an overdose. I mean, these are fourth graders telling me this, and so that hits home. You are never prepared for it. It catches you off guard every time because that's not what you're expecting when you go in. But that's why I so appreciate what we do. And one of the teachers whose classrooms I went into said, I'm so glad that you come in and do this because I know too many of these kids' stories. I wouldn't be able to present this as objective as you do. It's great to have an outside person come in and deliver these programs. So knowing that I'm giving those kids the tools to hopefully resist drug use and give them better coping mechanisms, giving them a place to be heard and seen, like we said, and feel valued, is really kind of my hope. And I'm really a person of hope, so I always have to hope that what we're giving them, what we're providing will be something that will help them in the future. But I also look at I'm going to say again, the heart and the passion that so many of our prevention specialists and some of our contracted providers have. It's amazing. Their stories really give me energy because so many of them have personal stories as well about why they do the work that they do. And that helps fill my cup. You know what I mean? So, but I have my time for me. I feel like finally 20 years after entering the professional world, I finally figured it out. Like, okay, so I'll, binge watch some TV, but like I tell all my fourth graders, if we're doing something too much, we've got to be careful that that's not taking over or, so it's balance, but I'm like Tracy too, I'm certainly not perfect. There are days when I go home and I feel the stress of the decisions that need to be made and the funding that we have and how far can we spread this to get as much bang for our buck to be able to reach as many kids as we possibly can in the county, or as many parents, or, we have our opioid overdose coalition. What can we do to reach as many people as possible? But again, I think about some of our subcommittee members on that overdose coalition and how passionate they are. And we've really got a good group of people that enjoys working together. And I feel like we're making progress and putting ourselves out there and getting things done in the community.
Yeah, I've started hearing a little bit about that. Rachel Schuster's been sharing that with me, and I know they're going to try to, share the podcast and how it connects to everything. And so I think that's really wonderful. And having someone or multiple people who have lived in the arena of substance abuse, right? They have been there. They've been in the trenches. Her episode came out today. It's actually a 2-part because I realized that we ended up talking for 2 hours. And I was like, oh, that's too long for one episode. Yeah. So I'm going to just tomorrow drop the little bit that's left over of it, like as a little bonus, to continue the conversation. The bulk of what she shared was her story, like who she is, what she does, but her actual overdose. And immediately this feeling of, well, that's it. It's over. Like, it's all over. She remembers being wheeled down the hallway and her supervisor being there, like, what did you take? What did you take? What did you take? She said, I knew that if I said it, that would be it. She's like, I just couldn't say it, even though I knew that for them to give me the proper care, that they needed to know what I had taken. But she said, my brain was just like, she was still trying to make it seem like she was able to do all of these things and do that. And that's someone who lives her life talking about it and the stigma. And so her story is really remarkable. And she believes that she is alive today because she's supposed to talk about this.
Yep.
Well, thank you for that. Is there anything else that we didn't get to touch on?
I was just thinking, as far as resources, we talked a lot about adults. I want to make sure that like parents are aware that there's the student assistance program in Butler County. Every school has a student assistance team or SAP team. And so that's available to connect students to mental health and drug and alcohol resources if there is an issue or a suspected issue. And that referral process can be started by a parent calling in and saying, can I talk to somebody on the SAP team so that I have some support? Because as a parent, that's really hard. I think parents really struggle with, how much do I get involved? Especially older kids, if they have young adults, how much should I get involved? How much should I push? What should I do about, just every decision I make with treatment or with whenever my kids, young or old, are home and might be living with me. And there are support groups in the community for parents as well. Several. I'm thinking of like Victory Group and Cranberry. Geyser runs a friends and family group. So those are really important, I think, for parents of kids of all ages to be able to connect and know that they're not alone. Because I think that's where the parents, family members are dealing with a lot of stigma as well. And feeling like, well, if my child, again, no matter what age, has a substance use disorder, that people are thinking that I should have done something differently. And that's not true, So for them to be able to connect with other people is really important, to know that they're not living it alone. And just like we talked about with people, meeting them where they are, everybody's recovery journey is different. Same thing for parents. Everybody's role as a parent is going to be different. Some people have asked, what about, should I tough love or love and support? And those are, that's mixed because it's different. Everybody's different. So I just want to make sure people know about that. And there's Al-Anon too. That's not just for parents, but for family members.
Mm-hmm.
And we can make sure, like you said, if there is information that we can make sure that you have that to put.
Yeah, that will all be included with this episode in the caption. That way, if you need to you can click right on those links or whatever, phone numbers. I'm going to put all of that in there for everyone. So, well, ladies, thank you. Thank you for doing a take two with me.
Right. Yeah, no problem.
We'll keep that amongst, yes, of course. Butler County Drug and Alcohol is located on West Diamond Street here in Butler. You can call, there's an 800 number, 292-3866.
That's the after hours for Center for Community Resources. That's the crisis number. So that's the number you would call if it's after 4:30 on the weekends.
Amazing. So that will be included here, and that, again, today I sat down with Tracey Hendrix and Lisa Gill. Thank you for being a part of this. You're working in a field that has to be rewarding at times, but also has to be very heavy at times too, right? But necessary. You are so necessary. So thank you for everything that you both do, for coming here to talk to me today. And it's that you meet people where they are. And I love that. We all need support. We all need help. We all have the same sort of hopes and dreams, right? And really, it's just about be a good person and be honest. And if you can help people, I think we all can help, right? In some capacity. So, and it can be really rewarding. So thank you for what you do. And all the resources will be here. So that's it for our episode today. Butler County Drug and Alcohol. These baddies beside me, everyone gets a title of baddie here, because truly you are. So yeah, all right, that's it.
Thank you.
Yeah, you're welcome. This episode is brought to you by Butler County District Attorney Richard A. Goldinger, R.W. McDonald & Sons Incorporated, Robert Stevens Jewelers. Thank you to our sponsors for your support on our first season of the Alter Ego podcast. Be sure to click the link in bio for your discount for BetterHelp Therapy online. 10% off your first month. Thank you for tuning in to Alter Ego. Join me every Monday for a new episode. Make sure to subscribe so you don't miss a single episode, and follow us on Instagram at Alter Ego Podcast. Until next time, stay safe, stay hopeful, stay kind.